Today, we're going to play detective. We're diving into one of the most common health issues that affects kids all over the world, anemia. And we're going to treat it like a mystery, following the exact same clues doctors use to crack the case. So let's get into it. First, you have to understand just how huge this mystery is. Get this. According to the World Health Organization, nearly half, 47% of all preschool-age children have anemia. That's almost 1 out of every 2 little kids on the planet. This isn't some rare thing, it's a massive global health challenge. So what even is anemia? Well, think of your body's red blood cells like a giant fleet of delivery trucks. Their one and only job is to pick up oxygen from the lungs and deliver it everywhere, to your brain, your muscles, every single cell. Anemia is what happens when that delivery service breaks down. You just don't have enough trucks, or maybe the trucks you do have aren't working right. And you can imagine when that critical oxygen delivery service starts to fail, especially in a child's body that's growing and developing at a crazy pace, the consequences can be really, really serious. And this isn't just about a child feeling a little tired. We're talking about a delivery failure that can actually get in the way of brain development, it can stunt growth, and it can make a kid much more likely to get sick. In the really severe cases, the heart has to work overtime to pump that oxygen-poor blood around, and that can even lead to heart failure. The stakes are just incredibly high. So when a child shows up with symptoms, how do doctors start to unravel this? Well, like any good detective, they don't just guess. They start by gathering the first clues in a very systematic way. The first step is always to get the story, asking about diet, if anyone else in the family has had anemia, things like that. But then comes the first big piece of hard evidence, a simple blood test called the complete blood count, or CBC. This test gives a snapshot of everything in the blood, but there's one clue inside that report that is absolutely crucial, the size of the red blood cells. This one measurement, called the mean corpuscular volume, or MCV, splits the entire investigation into 3 totally different paths. Are the cells too small? Are they too big? Or are they normal-sized? Each answer points to a different list of suspects. If the cells are small, you start thinking about things like iron deficiency. If they're big, maybe it's a vitamin issue. Let's follow that first path, the case of the small cells. All right, so our first case file opens up. The lab report comes back, and it says the red blood cells are microcytic. That's just the fancy word for smaller than they're supposed to be. This clue immediately helps us narrow down the investigation. And when we line up the usual suspects for this kind of small cell anemia, there is one culprit that stands head and shoulders above the rest: iron deficiency. It is, by a long shot, the most common cause of anemia in kids everywhere. Of course, there are other possibilities like certain genetic conditions, lead poisoning, or even chronic inflammation. And this is exactly why cracking the case of iron deficiency is so important. As Dr. Patrick Gallagher points out in the source material, the real danger here isn't just the anemia itself. It's the link between a lack of iron and problems with cognitive development. The good news? Some of those issues might actually be reversible if you catch it and treat it. And this chart really shows you when kids are most at risk. See that highlighted line? That's iron deficiency. And look where it peaks. Right there in infancy and the toddler years. That's exactly when the brain is doing its most explosive, most critical development, which makes this investigation all the more urgent. Okay, let's switch gears and open up our next case file. What if the lab results send our investigation in the complete opposite direction? What if the red blood cells are too big or macrocytic? Well, in this case, the list of suspects changes completely, and it almost always points toward nutrition. The prime suspects are now deficiencies in 2 crucial vitamins, B12 and folate. And these can be tied to very specific things, like a strict vegetarian diet being low in B12, or for infants, being fed goat's milk, which doesn't have much folate. Now, why would a lack of vitamins make cells bigger? It sounds kind of backward, right? Well, it's because both B12 and folate are absolutely essential for building DNA. Without enough of them, the body's little red blood cell factory can't divide the cells properly. So it ends up kicking out fewer, oversized, and frankly, clumsy cells that just can't do their delivery job very well. So once our investigation has finally pointed us to the right culprit, whether it's the small cells, the large cells, or something else entirely, we can finally move on to the best part, solving the case. And the beautiful thing about this whole step-by-step process is that the diagnosis basically hands you the solution. If it's a nutritional issue, like not enough iron or B12, the fix is often pretty straightforward.
supplements, and changing up the diet. If the anemia is just a symptom of some other disease, well, you treat that underlying disease. And for more complex genetic disorders, the treatment is all about supportive care and more, some really amazing advanced therapies.
And that, right there, is the biggest takeaway from our whole investigation today. Anemia in kids can feel like this huge, overwhelming problem. But by following the clues in a logical way, from the family story all the way down to the size of a single red blood cell, doctors can turn all that complexity into a clear diagnosis. And most important of all, that leads to a targeted plan to fix it. We've seen how this logical approach helps solve cases today, but it really makes you wonder about tomorrow, right? As our detective tools get even better with things like advanced genetic testing and brand new therapies, you have to ask, how close are we to a future where we can stop this oxygen delivery failure before it even starts and just make sure every single child has all the fuel